And joining us now on the debate, David Kaplan, Vice Chair at Global Public Affairs and former Liberal Cabinet Minister. Chris Stockwell, Principal at Stockwell Consulting and former Progressive Conservative Cabinet Minister. Peter Kormos, candidate for Niagara Regional Council and former NDP Cabinet Minister. And on the other side of the table, Matthew Mendelson, Director of the Mowat Centre. And we welcome back Don Drummond, Chair of the Commission on the Reform of Ontario's Public Services, better known as the Drummond Report. Hello to you all that are joining us. I want to start by simply going around the table and for each of you to tell me what you like and you don't like in this report. So let's start with you, David. What do you like in this report? Well,
there's several things that I like. Dawn recognizes that mental health in Ontario requires additional investment and is a significant driver of healthcare costs. I like the focus on more community care and home care. One of the questions I'd have for Dawn, though, is the capacity, the infrastructure doesn't exist right now to divert the patients out of hospital beds into other settings. What is the level of upfront investment that would be required in order to be able to accommodate those patients in rehabilitation, long-term care, home care, community care, and other types of setting aside from hospital care? And I do happen to know it's in the billions. So how do you square that kind of a circle where you don't have what's in place that you need to have, but it's desperately needed a reform that would need to move into the system?
Okay, I'm out of a job. He's asking the questions.
So first of all, it all has to be encompassed within the 2.5%. So
right.
All of the components don't all have to grow at 2.5%. So unlike what was shown in the illustrative budget track, you would actually have community care growing faster than the 2.5%. Hospitals, for example, will be growing a lot slower. The total physician compensation would have to grow slower than that. And the category that's been growing the fastest now for the last 15 years, being drugs, will have to be turned down quite substantially. Some of it will happen from the actions in 2010 for lowering the generic prices, but some of it we have to look at code of conducts. We write an awful lot of prescriptions. The average person in Ontario has got 10 prescriptions. We know from medical evidence your probability of having adverse cross effects amongst your prescriptions is very high if you got more than 8. We have to look at elements like that. Why did they get them? Because they could have come from 3 or 4 doctors and we don't have any records to tell them that they have all these other prescriptions. So it's just another example where you can actually get better care. 13% of the hospital beds are by people who are supposed to be in these other institutions, and they're in the hospitals $1,000 a day, where they could be at 1/10 that cost, less chances of infection, and getting better care.
But there's no doubt about it, but the capacity doesn't exist right now for home care capacity or long-term care, and you would have to build that infrastructure up so that people have those places to go. And there was a bit of a time lag. I'm just wondering what the costing is that, as you put your models together. What would the government need to invest in order to be able to build that infrastructure and have it in place so that people could be diverted from hospital bed into the community?
Okay, I'm going to hold you up there because we are going to talk about health in just a little while, but I do want to get first everyone's take on the report just in a general sense. So Chris Stockwell, what do you like in it?
Well, I'm glad you did it, frankly. I mean, it's obvious that you didn't tell me anything I didn't know. And I guess probably that's a good thing, because anyone with any economic sense or understanding of government spending could see this coming or knew this was there. What I don't like, it hasn't got a chance in hell of being implemented. There is no chance this government is going to do it. There's no chance it's going to happen in a minority government. And if they did do it, the big winners are the NDP. So it's wonderful from an economic point of view. It's wonderful. But from a political point of view, which I'm not saying you should have measured and you couldn't measure, you're not a politician. Now, to a snowball's chance in Haiti, this thing's getting approved.
Peter Kormos, Chris says it's a big win for the NDP if it actually goes through. What do you like?
No, and that's an interesting observation. I think he makes a very valid point. I was at Queen's Park today listening to the various commentaries by the leader of the Conservative Party, by Dwight Duncan, by Andrea Horwath. The spit certainly hit the fan down on the circle today. No two ways about it. One of the things that I think is really troubling, and Chris is right, the political will. You know, talk about shooting yourself in the foot, why don't you just amputate the feet?
Yeah.
No, seriously. But the other problem is you talk about healthcare, health and education are the 2 big ticket items at the provincial level. Baby boomers like me.
And me.
And you. And me. As you know, we've just begun to reach retirement age. We're going to live longer than our parents did, hopefully. The burden on health care, home care, and you talk about the lag, David, is going to be huge. Lord love a duck. We can't, well, we're incapable of dealing with the load that we have now in terms of home care, those sorts of things. Never mind the intense new pressure that's going to happen in 10 years.
Okay, Peter.
One moment. How, Mr. Drummond, handicapped were you when you were told that you couldn't talk about increasing revenues?
Okay, hold on. Wait, the question was, what do you like, Peter? What do you like in this thing? I'll ask him the question.
Well, it's well written. It's well written, well drafted.
There's nothing beyond that. You know.
Well, look. There's a whole. What I don't like is how Dwight Duncan responded to it, because he was obtuse. He was less than direct. He's defending his full day kindergarten education.
Yeah, to buttress the point Peter's making here, and this is what I'm going to tell you. Before this thing gets birthed, before it's birthed, the government's already dumping on really what I think is the cornerstone of your report, all-day kindergarten. And they're saying, okay, we're not going to do that. Well, if the cornerstone of the report, because that's $1.5 billion as I understand it, they're already saying we're not going to do it, how seriously do you think they're taking it?
Well, maybe they're going to find $1.5 billion.
Oh, yeah.
I'm not
Matthew, help me out here. Matthew, help me out here. What do you like?
Well, I think this is one of the most important reports in Ontario's history. I think this report is sophisticated. It isn't just about budget measures. It's about how government does its business. It is about accountability. It is about transparency. It is about measuring results. It is about the whole suite of government activity. And this report, I think, sets a framework and a blueprint for moving forward to avoiding discussions about old debates about status quo versus cuts. Ontario is no longer in a situation where I think we can afford a sterile, tired debate about whether we're preserving the status quo or whether we're cutting savagely. This document isn't about cuts. This document is about how we transform how the government works to deliver better results for less money. And I have to say that I think that the thing that I like most about it is it's sophisticated. What I'm concerned about is that we're not going to have a sophisticated debate about it. And that's not about the government or any particular party. The recommendations in this report really merit serious consideration and discussion because they're sophisticated. And I'm concerned that the quality of discourse around this report is not going to be as sophisticated as its content.
Meaning what? That it's going to be too partisan and get tied up in all the politics?
Well, that it's going to be characterized, this document's either a document that is all about spending cuts or, we're not allowed to talk about revenue increases. This document is about how you transform the state. This document is about how you transform government. That discussion is going on all around the world. It's not going on in a sophisticated way yet in Canada. This document begins to set the framework for that discussion in Ontario, and it's going to take place in other provinces as well over the next decade, and this will continue to serve as a template. But when you look at the detail in the health discussion. I mean, we're talking about community care, and David talked about that. How do you get patients out of hospitals and into community care? That's a really important discussion. It saves money. It's not about cuts. It's about how you get good public health and health outcomes for less money in better ways. And that's community health care. It's helping patients navigate through systems. It's reducing their reliance on prescriptions. It's empowering pharmacists
to do more work. But it's also not rocket science either.
Yeah, I agree.
It's not rocket science.
I don't know what that means.
Well, getting people. How many times has that issue been raised by opposition caucuses?
Everybody's faced it.
Larry Grossman was health minister. I mean, they've been talking about this for 30 years.
But I think this report lays it out in a very, very detailed way, and I think we're in a new situation. I think context matters, and I think you can talk about community care when you're in a surplus and you don't therefore have the power to challenge entrenched stakeholders, entrenched institutions. When you have a fiscal situation like we have now, all of a sudden that is a different context and it creates a different window of opportunity for a new context.
Okay, I want to get Don to come in here. From what you're hearing, what do you want to say to these guys? They say this doesn't have a chance in, I don't know, he says snowball in Haiti or something like that.
I'll deal with the two more technical ones. First, I feel hard done by the mandate not to look at tax increases, not for a second. I was the ADM of tax policy in the federal government. You tell me how many billions of dollars you want to raise, and I can tell you how to do it in about 20 seconds. And in fact, I could write the legislation within 2 minutes. That's easy. You don't need a commission to do the type of technical work we did on the revenue. That's a perfectly legitimate option for the people of Ontario and its government to consider. But just keep this in mind. I'll just give you an illustration. We have 0.8% program spending growth. Suppose you wanted to slack off and have 2%. You'd have to raise the HST rate by 3 percentage points, or you'd have to raise every single tax in the province by 10%, right across the entire board. And that's still, you got to bring down the 6.5% program spending growth to 2. That's still out of restraint. So there's no easy way out on the tax side. The aging of the population, that's just an empirical issue. We know, thanks to the Canadian Health Institute, what the average health expenditures are of every age, and we can map that into the aging of the population. It is adding 1 percentage point per year growth to healthcare. In the last 10 years, it added half. So the increment's a lousy 0.5%. It is not the tsunami that's sinking it. What is sinking it is the inefficiency and the increase of the intensity use of the healthcare system. It's adding to the cost pressures, but it's not changing it.
In the past, though, Don, we've grown our way out of these problems in Ontario. Is that no longer feasible?
That is really getting to the key of the issue. Yeah, exactly. And if you look back in the late 1990s, in the case of Ontario, after 3 years of pretty brutal expenditures, despite the fact that taxes are being cut like crazy, revenues all of a sudden started to surge. And governments plowed that back in expenditures. My bet is that's not going to happen this time around. It's not going to happen any particular year, and it's not going to happen on a sustained basis, and that has ongoing implications. Just in terms of the probability of it being restrained, of being adopted, it's not my business to comment, and I have no insider information, but let's say if you do think that at some point in the future you have to come reasonably close to balance the budget, you're kind of stuck. I mean, we put out this estimate, the deficit on its own accord to $30 billion. Someone's going to have to figure out what to do with that. I don't think somebody's going to be able to look at our economic assumptions and say that they're crazy, they're off the wall. I think they're more or less going to survive as a realistic view about it. And so you're going to have to explicitly say to people, I don't ever care about balancing the budget. I don't think you can do that. And the other thing, we have to learn our lessons from history. The public sentiment changed on a dime and around between 1994 and 1995. And when federal and provincial governments came to do their budgets in 1995 and 1996, there was no amount of spending cuts that was enough to satisfy the public. That attitude didn't stay in place for a long time. It could come again. So a lot of the things that don't seem feasible because people have not been exposed to the context may all of a sudden become feasible. Maybe I'm wrong, but the situation is a lot more fluid than we tend to anticipate.
All right, I want to talk about education because a number of recommendations in your report, Don, seek cost saving in primary education. David Kaplan, is that good policy?
Cost saving in primary education? Well, if you ask the government, they're going to say, they're going to have a lot of difficulty with that. I mean, Mr. McGuinty has hung his hat as the education premier. He's lowering class sizes, full day kindergarten and the like. I can't see them accepting the kind of recommendations that Don has made. They've as much said so, and I think that it poses a real challenge for them because if they don't accept them, what are they going to replace it with? What area could they move in? And I think that you've made it very difficult for them, Don, to be able to choose because you haven't given them a lot of other options where they could possibly go.
There's also some issues with the collective bargaining too. When you want to raise class sizes, that's collective bargaining. You want to talk about pension reform, that's collective bargaining. Unless you're going to legislate these changes, and I don't think the Liberals have the stomach for that, take my word for it. Unless you're going to legislate these changes, the teachers' unions are going to kicking and screaming to make those kinds of deals for class sizes. You're only probably talking 3 kids per class. I understand that you don't think it's a lot. I don't think it's a lot. But talk to teachers. They do.
Chris, I'm not sure of that. And the recent round of bargaining with Mark Ferguson, Local 416, and City of Toronto illustrated an incredibly enlightened and mature approach to collective bargaining on the part of those CUPE workers.
Agreed, but that's the City of Toronto, and I think the City of Toronto were fed up with their union workers. Let me finish. Municipally. Okay. I don't think stay-at-home moms and helicopter moms are that interested in talking about increased class sizes. And that's the base for the Liberals. And they're the bubble wrap mothers that are going to say, no, I don't want to see my class grow by 3. And I don't know a union that's going to give up pension reform, Pete, without a big fight.
You're right, not without a huge fight.
But I can tell you the straw poll in my neighborhood is there's no one who will accept the proposition that lower class sizes doesn't equal better education. And so seeing that goes up, I can tell you
Malcolm
that
Gladwell doesn't live in your neighborhood then.
he does not live in my neighborhood, I can assure you. But that's just the feeling that parents have, that these are the kind of measures
As
that they want
misguided
to
as it is.
David,
whether there's empirical evidence to back it up or not.
But the same way subways are a better form of public transit than surface rail. And the problem is, John Tory, for instance, or I'm sorry, Tim Hudak the other day.
Let's not get off topic here.
No, Tim Hudak the other day said he supports Rob Ford and his quest for subways, but he wouldn't stand up and commit to funding them in the event that he formed the next government here in the province of Ontario. People have got to make decisions, and I think Mr. Drummond's been very articulate talking about people have to make choices.
Okay, I'm going to go to
People have to
Matthew,
prioritize.
and then I want to read something on Twitter that came into us.
Sure. I think we can get distracted by any one particular recommendation. There are lots of recommendations in here. None of them individually are going to fix the fiscal situation. What's laid out here, in my view, is a vision of transformation in the public service. And I don't have a crystal ball either in terms of how stakeholders are going to react to all of these recommendations. But as Dawn said, the situation is fluid, and I think we're at a critical moment for all of the various transfer payment agencies. So that's municipalities, school boards, hospitals, universities, colleges, as well as labor who work there, teachers, nurses, firefighters, etc. Are they going to raise the barricades against this? Or are they going to work as partners? And I actually think that a lot of them are ready to say, you know, we can do our jobs in somewhat different ways. We can do them more flexibly. We can get more value for money. We want to help define what...
Very optimistic.
Have you ever negotiated with a union in your life? Have you ever negotiated with a union?
But let's inject a little bit of facts here. You mentioned the teachers would never accept any changes in the pension. So the teachers...
No, they will accept them if you legislate it.
No, I think you're wrong there. I mean, in fact, you are wrong. You're also missing a historical event that did occur. So the teachers' contribution rates are going to 13.1%. I don't mean combined, I mean the individual rates, and that's only one of many sources of deductions. There's not a lot of money left in their paycheck. They did agree to limit indexation to 60% for teachers post-2009. That was not legislated and forced upon them. There are different forces coming together. If they go into an actuarial deficiency again, I do not think the members themselves will agree to a further contribution increase.
All the while getting a pay hike. While they negotiated a pay hike in those years. Now you try and get them to agree to a pension reform reduction and give them no pay hike. You're going to have a problem.
But again, let's come back. There's legislation on this. The default in the legislation right now is if a pension plan goes into an actuarial deficiency, the default is the contribution rates go up. Even from the members' perspective, they are coming to the realization that we have hit the limit. The default automatically shifts to you have to trim the benefits in some fashion.
I appreciate that. Okay, I don't want to get into this. Okay. Clearly, you got a problem.
I want to read a tweet that came in. This one's for you, Don. Can we bring that up there, Michael? The tweet asks, it's about education. It says, was Drummond told not to mention Catholic school funding? We deserve to know.
No, I definitely was not. The separate school system is enshrined in the Constitution, and we chose deliberately not to enter into that because it is protected by the Constitution.
Couldn't go there.
It's not. Well, why would we propose something that's going to rewrite the Constitution?
You weren't tasked with that.
No one said not to go there, but we chose not to.
We have a whole lot of other proposals that are going to be as difficult, if not more difficult, than dealing with the public funding of Catholic schools.
Okay, I want to talk about health. We talked a little bit about it at the beginning of our conversation. I want to ask you, Chris, I'm going to start with you. Can the government really cap its health budget, do you think, at 2.5%? You've been in government before. You've dealt with all of this.
I was in a government that was probably the most, the toughest on spending, the Mike Harris administration. And we couldn't do it. We couldn't do it. We couldn't cap it at 2.5%. We were running at 5-6%.
Not even close.
Not even close. I'm not suggesting we were close. And we were far tougher than tougher may be the wrong word, but we were far more fiscally aware than, say, the NDP or the Liberals when it came to keeping costs capped. I'm not blaming them because we couldn't do it, they couldn't do it. There is no chance in heck that you can cap it at 2.5 because they have the sick people. That's the problem in politics. When you're a government and they have the sick people win public support. That's all there is to it.
That's the politics of it. And quite frankly, people are very concerned when they hear this observation that this is about making government work in a different way. Is that code language for privatization? Is it code language for contracting out?
Should do.
Well, I know you propose that, you agree with that, but that scares the daylights out of a whole lot of people out there who believe in a strong public sector. So people got to be a little more candid about what these efficiencies are going to look like and what they're going to consist of.
All right, but let me ask you, David, because you were health minister at one point, right? And so do you see innovation, ways to innovate that we can only increase our spending on healthcare to 2.5 per year?
There are ways to innovate, and in fact, the government has, as Don knows, made a lot of good moves in the right direction. But getting to 2.5 is a big road ahead, and I don't see them being able to do that right away. I don't think that there is the infrastructure in place to be able to move patients from institutional care into the community as much as we would like and as much has been invested. That would be a necessary condition. I mean, there's some other interesting recommendations that Dawn makes. One is we should look at a national pharma program. This has been a recurring recommendation for the last 25 years from premiers, from Roy Romano, from other commissions
New Democrats
that have looked at this, but it's never been achieved. And the reason is because provinces all have different levels and support different kinds of programs. And whenever they get together, they can never come to an agreement to be able to put it into place. And I think the question is, why has that not worked? Why has it not been achieved? The federal government doesn't want to be a player. They don't want to force this to happen. I think Dawn makes another interesting recommendation that there should be a health commission to help to guide some of the reform. I have no doubt that the government will adopt that particular recommendation as a punt.
Let's meet.
Right?
Yeah.
Absolutely.
I want to ask Dawn, though, is this 2.5% in healthcare, is this the most important recommendation in this report as you see it?
Well, it is in the sense that it's over 40% of the spending. So if health can't be reined in, then nothing else can. Because you have to take these reactions to their logical conclusion. Something else has to give. If healthcare is going to go by 2.5, you have to take it out of the sum. No one seemed to be wildly enthusiastic about the education recommendations already on the table, so I'm guessing you're not going to be supportive of going further. It's the easiest thing, but it's a cop-out to say this mysterious residual that's everything else should go down further. 1/3 of that residual is by contract, the government's contributions to public pension, and another included in that is the amortization of infrastructure that's already been spent. There's nothing, you can't take more out of that.
That's the other dimension. Municipalities like the ones where I come from that have lost all their industrial assessment, factories shut down left and right, none left. Those communities are cash starved in terms of municipal revenues. They've got decaying infrastructure. They've got brownfields and toxic properties that need remediation. And one of the things, because you made reference to infrastructure, but municipalities are in deep trouble as well.
Yeah, the answer that we can't get to 2.5% is a little bit depressing because we have to. I mean, there's no choice that we have to bring down the spending in healthcare at some point, whether it's this year or next year or the year after. That has to happen. So it's going to happen. And I agree with David that there are capacity issues and can the system absorb so much change so quickly. There's no doubt about that. But this is not about privatization in this report, and this isn't about wishful thinking. I mean, if you go through the recommendations and you talk about moving a lot of procedures out of hospitals to clinics performing routine procedures like knee operations or cataract surgeries. You talk about taking patients with chronic conditions away from the hospitals that they currently use and work with networks of providers and patient navigators that help them find often much less expensive procedures. The use of technology and recouping some of the productivity gains that we've had from investing in this technology. There are lots of things. None of them are about $1 billion or $2 billion or $4 billion. But you know, 100 million here, 100 million there, you're starting to talk about real money soon.
Even before you get to the 2.5 billion, Don's #1 recommendation is that the government should have a visionary plan.
20-year plan.
A 20-year plan. And I think that having a visionary plan is an excellent idea. 20 years may be a little bit long. As Minister of Health, I developed a 10-year plan. It was never released because it was felt at the time that the public, there was no appetite for it. To be able to project 10 years, it was only a 10-year plan, into the future. And it talked about being patient-centered. It talked about integrating, using electronic record, talked as primary care as the first point of contact, all of the elements that Dawn has talked about. So that plan is currently sitting on a shelf in the Ministry of Health.
But David, you were Minister of Health. New Democrats agree that...
shall blow the dust off.
Exactly, but New Democrats agree with that proposition, have been advocating along with a whole lot of others for many, many years. You tell us, you were Minister of Health, why couldn't, again, I say it's not rocket science, Why couldn't that be achieved? What was the static inertia that was pushing back?
Well, the public just won't accept, and the demands on health care. For every dollar that you spend, there's demands for $10 more. Not just on the operator, on the capital side as well. And it's an insatiable appetite for money. I used to jokingly say that every part of the body has 3 advocacy organizations, and then some according to all of the different professional groups. And it's absolutely true.
You know, I think we really need to stop focusing on the past, like why the New Democrats didn't do something in 1990, or why.
Like 3 former cabinet ministers.
I understand that, but we're at a really different moment here. Where we have
Hold on, Chris.
I'm not ignoring the past. I'm saying that we really need to change the conversation. I find that talking about why someone didn't do something in 93 or 98, we have a large deficit. It is structural. Ontario's economy, because of a variety of global changes, rise of Asia, decline of the US, rise of the resource sector, there are a whole bunch of things where we're not going to have the same kind of GDP growth that we've had for the last 20 years. So we need to start, I think, as Ontarians, focus all together on how do we deliver public services better for less money. And this report sketches out a lot of realistic ways to do that.
I want to let Don get in here, because a moment ago you sort of gasped in what sounded like frustration listening to sort of how partisan this is all going to become so quickly.
Well, please.
Well, hold on.
It's not partisan. We've all agreed. Yeah. There's nothing partisan about this at all. You can't keep it at 2.5. You can't keep it at 2.5. You can't keep it at 2.5.
I don't accept that for a moment. Let's just consider a few facts here. So if we benchmark, as the OECD has, Canada's healthcare system and the most efficient systems in the world, some of the European, we spend roughly 30% of our GDP in addition to what they do. If you could just get half of those efficiencies out, you could get 2.5% growth easily. 1% of the Ontario population accounts for 34% of the healthcare. Why do they do it? Well, one reason is they have multiple morbidities. It's always going to be a high number. But one of the reasons the cost is so high is our system is not coordinated. Somebody with congestive heart failure gets released from a hospital. There's no electronic message. The physician doesn't know that they're back home. The community care access center doesn't know they're back home. No community nurse goes to visit that person. They don't feel very well. What do? They're back into the hospital, back in the hospital, back in the hospital. Again, you can save money by addressing that using modern evidence-based techniques and improve the quality of that person's care.
We're going to have to move on. We have about 10 minutes left, and I want to get to some other areas. I want to talk about tuition grants for college and university undergraduate students. Cancelling the new 30% tuition grant for college and university students. Chris Stockwell, is this good policy?
Yes, it's excellent. I would endorse it in a heartbeat, and I would endorse a lot of your recommendations. I think it's a great report in that sense, and post-secondary education I agree with in that fashion. Probably the most people that are most capable of looking after themselves with respect to our university students and the situation. I think it's a good report. My problem is I realize what government is. I'd be a blunt instrument guy. I'd freeze wages, I'd roll back staff 10%, I'd do that kind of stuff. And then in the process of doing that, you can examine efficiencies in the system. But the problem is that if you don't do that, if you don't roll back staff right across the province by 10%, if you don't freeze wages, if you don't cap health care, the only way to stop government from spending money is stop giving them money. It's like having a teenager. A teenager is convinced every dollar you give them, they spent it wisely, and then they come back for more. The only way you stop them from spending is stop giving them your money. And that's the only way government's going to be stopped. From that education point of view, crackerjack idea.
David Kaplan, I want to ask you about another thing in the report today, paying more for hydro, paying for the full price of water, sort of pocketbook items, paying to park in GO parking lots. Should they go ahead despite, the political toll, really, that they might reap?
There is always a difficulty in accepting those kind of recommendations, but Chris has introduced a bill calling for full cost pricing of water. I introduced a bill calling for full cost pricing of water. Never been accepted, and it never will be accepted, because it takes courage, and it takes backing people off who have been used to undervaluing resources like water or energy or others. And if Matthew's right that there really is this shift, I haven't seen it that people are accepting of having to pay more for all of these very basic necessities, even though it is a reality, somebody is going to have to pay along the lines. We have vastly underinvested in our infrastructures, and somewhere we've got to find the money to be able to, Peter makes a good point, whether it's in a municipal, whether it's on a provincial scale, or even on a national scale, the money has to come from somewhere. I agree with Don's recommendations. I've introduced a bill calling for the wholesale restructuring of the water sector and to implement exactly those ideas. I don't think it's ever going to happen.
Don, these guys can agree with you or disagree with you, but at the end of the day, this is about political will. And you were, part of the biggest deficit reduction exercise in Canadian history under Paul Martin, when Paul Martin did it in the 90s. Do you actually believe that the McGuinty government has the strength to do this?
Yeah, I do, because I think that they have no choice. And I would say that was regardless of who was in economic power. And again, you got to come back to this full cycle. Do you reject the notion that the government should get back somewhere in vicinity of balanced budget within the next 7 or 8 years? If you accept that premise, then you have to do something along the lines of what we're recommending. It doesn't have to be exactly that. It could be some different form of it, but something has to give. And when we come back to this full cost of water and stuff, you have to be open with people. They're paying for it. They're either borrowing it and they're going to pay for it later, or they're paying it through their general taxes. It's just deceiving people to think that they're paying for half of the price.
That's fascinating, because all three political parties and their leaders campaigned in the last provincial election on a commitment to balancing the budget. Andrea Horvath and the New Democrats did, the Conservatives did.
But none of them were legitimate.
The Liberals did.
They all made their numbers up.
Well, wait a minute. No. You see, Mr. McGuinty, although he only acquired a minority government, has had the cockiness and arrogance of somebody who thinks they've got a majority. And he has not displayed any interest in being collaborative with the other two political parties in the legislature. This is a huge opportunity in a minority government for there to be collaborative work on the part of the whole parliament. He talks about my government
setting up committees.
Well, that's right. You're damn right they can't agree on it, because McGuinty's thrown the monkey wrench into the process.
I think the question of collaboration is really important, and I think it goes beyond the parties. I really do believe, and I take David's point, we haven't perhaps seen the shift yet in public, but I think Don's report is part of that, and I think we're going to be going through. I think we're going through a shift. But the collaboration isn't just about parties in the legislature. The collaboration is across communities and sectors and Ontario residents, and that's why when we talk about things like GO parking fees, and people don't want to pay a few bucks to park at the GO parking lot, people have to see that there's shared buy-in and shared responsibility, and everyone is doing their part. If people say, I'm going to pay a few bucks more for water, I mean, a few bucks more for water isn't the end of the world, but people say, oh, well, I don't want to pay a few bucks more for water because so-and-so is getting a raise or whatever the issue is. So I do think this report sketches out a whole series of things where everyone will feel it, but this isn't about, blood in the streets. Well, this isn't about, savaging public services or telling people that they have to roll back their wages by 20%. This is about moderation. This is about shared responsibility and everyone doing their part.
For the politicians, this is always going to be, you're throwing people out of their homes. Seniors will lose their homes because water rates are going up. And it'll be all of the dire and doomsday scenarios. It's never the calm, dispassionate kind of
job to create the will to create change, is it not?
Well, sure, but nobody's willing to have that kind of conversation because you can't have it.
But Don's saying that we have to. We don't have a choice.
The problem you have here is simply this. And Mr. Drummond was the Romulan cloaking device. He was the guy that they were going to put up there, and he was going to make all these recommendations, and the Liberals are going to say, well, we have to do it because Mr. Drummond's a bright man, and he's told us we have to do it or we're going to hell in a handbasket. The problem they're faced with is, I've seen it 100 times, you can't inoculate yourself as a government against cuts. It's never worked. Every party has tried it. And I understand what he is saying, and I agree with a lot of what he says, but he was the cloaking device.
Is that a Star Trek reference?
At a Star Trek. Now, the point I'm making is, when you go down to the ground and you say, well, I have to do this, Mr. Drummond, the bright man, or recognize this, they look you in the eye and they say, I didn't vote for Mr. Drummond. I voted for you. And that's where the rubber meets the road.
Chris, well, I'll tell you where the rubber hits the road. Roll back the corporate tax cuts. They haven't created a single new job in the province of Ontario. Corporate tax cuts didn't save the Caterpillar engine locomotive plant in London, Ontario. Didn't save any of the industries down in Niagara and through Hamilton.
So it's
roll
about
back
raising
the corporate
taxes.
tax cuts.
So
roll back the corporate tax cuts and use those revenues to reduce the deficit.
There's no doubt that the politics of any of this are not easy. And there's no doubt that we are not Greece. Ontario isn't anywhere like Greece. But people are aware. I understand, and I take the point. I've never knocked on doors, and I take the point that people say, we didn't vote for Don, we voted for you, and we don't want our water rate. I get all of that. But people are also looking at what's going on around the world, and that has an effect on people.
Yes.
I mean, they look at what's going on in Europe, and they can see that in the UK, in the United Kingdom, they've been cutting budgets by 20% across the board. They've been raising their harmonized sales tax up to 20%. Greece and Italy, like people see this,
Ontarians
and they
just
don't.
don't
And
feel
I think
that way
Ontarians
yet.
say we don't want to end up there.
But
It's
they
not
don't
we're going to
feel
end up there
that
in
way
2
yet.
years.
But they don't feel that they have to take those measures
Yeah,
because
they don't
it's
feel
not
that
as
way
bad as it is in Spain
Greece
or
or
Portugal
Spain. I agree with you,
or
David.
even in the United States. I mean, property values in the United States have plummeted, but they have not here.
But our economy is so tied to the United States.
we know that.
We have.
Folks, we just have about a minute left. I want to ask you, you've done your homework, you handed
Right.
it in today. You weren't allowed to look at revenues. I want to ask you, should we raise taxes in this province?
So I would do one variant of our mandate. What I would call the revenue burden, if you look at the ratio between revenues and total income in the Ontario economy relative to the current structure of revenues, it would actually decline. And if you look at our status quo projection, that revenue ratio declines. I wouldn't do all of this pain on the spending side and allow that decline. I would at least hold that flat. And why does it decline? It's because most of the user fees don't get increased over time. Gasoline taxes, tobacco taxes are fixed and specific. Every time property assessments go up, the government automatically lowers the education property tax rate to offset that. I would address all of that.
Okay.
And there's all kinds of, but keep in mind, that would allow that 0.8% program spending growth number to go to 1.1, in which it doesn't take very many of the 362 recommendations off the table. Yeah, you switch to an ad valorem.
Okay.
There's some relatively low-hanging fruit on the revenue side,
Yeah.
but let's make no mistake about it, it doesn't take the issue. I mean, come back to the corporate income tax that was raised.
You're going to have to be quick.
Well,
Don,
the
we're almost
debate
out of
about
time.
the last point of the corporate income tax is 800 million. Our status quo deficit of 30.2 would go to 29.4. What do you do 2 seconds later?
Okay, I want to thank all five of you gentlemen for this lively conversation and for our lively chat at our homepage at theagenda.tvo.org. Thank you to you all.
My pleasure. Banks and insurance companies don't need corporate tax cuts.
Okay, former Liberal Cabinet Minister David Kaplan, thank you to you.
Thank you.
Peter Cormos, former NDP Cabinet Minister Chris Stockwell,
Thank you.
former Progressive Conservative Cabinet Minister, and on my right-hand side, Matthew Mendelson of the Mowat Centre. And the man with the plan and the man of the day and the man of the hour, Don Drummond. Thank you for coming in.
Well done, Don.
Support Ontario's public television. Donate at tvo.org.